And so this is our Global Prize presentation and keynote address. Today we are honoring Dr. Bella Kaufman, Vassar's 2020 Global Prize recipient. And here to introduce Dr. Kaufman are Shire and Len Potter. Shire and Len are incredible supporters, advocates, and partners of the Vassar Center. In 2013, they generously established and endowed the Vassar Global Prize to annually honor and fund a visionary scientist who has significantly advanced BRCA1 and BRCA2 related cancer research. Over the years, this prize has recognized many of the top scientists in our field. We are honored to add Dr. Kaufman to the list of prestigious recipients. Shire and Len, the floor is yours.
Thank you, Susan. Shire and I are honored to be with you all today for the Vassar Global Prize presentation. Over the last 8 years, the Vassar Global Prize has helped accelerate BRCA-related cancer research around the world, funding projects that are providing hope of a future with better options for BRCA1 and 2 mutation carriers and their families. This is exactly what we hoped for when establishing this prize. We wanted to honor pioneering BRCA researchers for the substantial contributions they have made to the field and for the incredible difference they are making in the lives of BRCA mutation carriers. We wanted that have the potential to change how we detect and treat BRCA-related cancers and one day, hopefully, to prevent them altogether. We know that the only way to do this is to invest in research, and we are so proud of the role that the Vassar Center and this Vassar Global Prize have played in moving cutting-edge science from the bench to the bedside.
And no one exemplifies the spirit of this award better than this year's recipient, Dr. Bella Kaufman from Sheba Medical Center in Israel. Dr. Kaufman is a leading clinician and breast cancer researcher in the field of BRCA genetics and has been an investigator on many important clinical trials, including several that played a key role in the development of PARP inhibitors for the treatment of BRCA-related cancers. As you will see shortly, Dr. Kaufman is a beloved and influential mentor, collaborator, and inspiration to her colleagues in the breast cancer and BRCA research communities. Dr. Kaufman is also the founder and leader of the Israeli Consortium for Hereditary Breast Cancer and was formerly the secretary of the Israeli Breast Group. Dr. Kaufman is a member of the Israeli Cancer Association's research and steering committees, and she's published more than 125 papers and presented at dozens of scientific meetings around the world, enriching the field with her knowledge, expertise, and insight. Dr. Kaufman's innumerable accomplishments have helped bring game-changing treatments to patients with BRCA-related cancers, and her exceptional work and leadership will have a lasting impact on all progress made in the BRCA field. However, in addition to being a renowned doctor and scientist, it's very clear that Dr. Kaufman is an exceptional and very special person. There's a Hebrew term that feels like it's applicable to Dr. Kaufman, Gadol Hador, which means a great of a generation. And it's used to refer to someone whose scholarship is combined with their goodness, and as a result, they become a shining light to all those that know them. As the Global Prize recipient, Dr. Kaufman has received a replica of the sculpture that hangs in the lobby of the Pancreatic Center for Advanced Medicine at Penn, called Homologous Hope. The beautiful piece of art was created especially for the Vassar Center by internationally renowned artist Mara Hazeltine. It's an accurate depiction of the part of the BRCA protein that's involved with DNA repair. And as you could see, the light from this prize, there's a light that runs through this prize, and that light celebrates the hope that the Vassar Center and researchers like Dr. Kaufman are giving to countless families and their loved ones. And in this instance, we believe it also represents the shining light that Dr. Kaufman brings all who are touched by her. Dr. Kaufman, toda rabba lachem al kol ma she'atem osim. Thank you very much for everything you do. We will now play a tribute video Vassar has created featuring some of the past Global Prize recipients and many of Dr. Kaufman's friends and colleagues. As you will clearly see, Dr. Kaufman has made a lasting impact upon her many fans around the world who are eager to celebrate her major contributions to the field.
Hello, everyone. I'm Susan Domchek, the director of the Vassar Center for BRCA, and we are going to present to you a video in tribute to our dear colleague and friend, Bella Kaufman. You'll have heard about all her incredible accomplishments before this video gets started, but we all know Bella as an incredibly accomplished researcher, fiercely dedicated to her patients and to advancing the cause of the field. But I think what you'll hear from all of us today on this video is that we are equally devoted to Bella as a friend. She is an incredible friend and colleague. She probably has had at least half of us over to dinner at her house at Tel Aviv. I have been fortunate to be part of that and to have met her amazing family. Bella and I first really got to know each other in 2013 when I was recovering from surgery. She was dealing with a new diagnosis of a recurrence, and she was in Philadelphia visiting her brother. And since that time, we have talked many, many times, and I have been incredibly grateful for her mentorship, but most importantly, for her friendship. You're going to hear a lot more about this. And Bella, we thank you for everything you have done for the field, for our patients, and for us. Thank you.
I'm truly delighted to convey my congratulations to Bella Kaufman on the award of a Vassar Global Prize in 2021. Bella has for many years been a leader in the field of BRCA research. As all of you know, her contributions are many and varied. They include her efforts in founding and leading the Israeli Consortium for Hereditary Breast Cancer, in leading clinical trials underpinning the clinical development of PARP inhibitors, and in bringing medical services to underserved populations. I really cannot think of a more deserving winner. Bella, I only wish that I could convey my congratulations and best wishes to you in person. All the best.
Hello, Bella. Greetings from Cambridge, and so sorry we can't meet in person. Very many congratulations on the Vassar Global Award. This is so richly deserved. You've made such a major contribution to BRCA1 and BRCA2 research and the management of women with hereditary breast cancer, both in Israel and around the world. I hope we can toast your success soon in person.
I am really delighted to join everybody and share in celebrating the success of my good friend Bella Kaufman as she is awarded the Vassar Global Prize. Wow, she is one of the most deserving people I could ever imagine for this prize. She is a fantastic clinical trialist, world renowned for her success in translating exciting laboratory advances into meaningful treatments for patients. She is a compassionate provider who has been recognized as a humanitarian by my organization, ASCO, back in 2013. And she's a great friend who anybody can count on to go above and beyond. She even once went so far as to pry my son's passport out of a locked room in Tel Aviv in 2006, gather him up and get him on an airplane home safely, as unfortunately missiles were flying overhead that summer. There is nothing that Bella wouldn't do for a friend, and there's nothing that she wouldn't do for our global community. Bella, I love you. We love you. Congratulations.
Dear Bella, I'm especially happy today with the opportunity to dedicate some words to you, my friend and colleague. It has been more than 10 years since we met, within a group of passionate oncologists from everywhere, excited for the possibility of turning a genetic vulnerability into a therapeutic opportunity. Now, this is a reality, and a great piece of merit derives from your work. Besides this, many international conferences, especially in San Antonio, provided us with the opportunity to share a cup of coffee, sitting anywhere in a corridor, and talking about the hobbies or the family, your wonderful and lovely family. Today, you will be awarded with the 2020 Vassar Global Prize, a very much deserved recognition to your professional career. Bella, I'm very happy for what it means to you and your family, and I'm sending to you my deepest heartfelt congratulations. All my best.
Hello, Bella. I'm so pleased to be here today to honor someone who really is one of my heroes. I'm delighted that you've received this award, and I'm only sorry that we're not all together to celebrate you in person. You are an inspiration to all of us. Your courage, your determination, and the love that you bring to your role as a physician, but also to your community, your communities in Israel and your communities internationally, making us always proud to be part of your world and to work with you on projects, on trials, on ways to make the world a better place. Your bravery in sharing your personal journey for the benefit of your patients and your colleagues, and the very full and completely genuine way in which you make all of us be better. It's really something special. I'm proud of you. I'm proud for you. I only hope that we have a long time to get together in person to celebrate all the wonderful things that you are. Thank you.
Well, we wouldn't have figured this one out, would we? I'm sorry that it's been a long time since we've been able to get together. I'm glad that Susan pulled us together so that we could all say hello to you and let you know that we're thinking about you. You know, I was reflecting on this, and you and I have known each other for quite a long time now. And there are many things that I've always appreciated about you, but the one that really jumps to the top of my mind is your gentleness and compassion and your acceptance of everything that comes. I've always thought that that was very, very old soul of you. And I've drawn strength from that. And I've reflected on that as something that I aspire to. Of course, most people would laugh when they thought that I was aspiring to something that was a little bit more reflective and gentle, but it is what it is. So I hope you're well. I hope that we can be together. And of course, you always know if you need anything that I can help with, feel free to reach out. Hope to touch base soon. Bye.
Dearest Bella, I'm just so privileged and I'm so proud to be here for you in this way. You have been a mentor for me in so many ways. You've been a clinical mentor. Even though I didn't follow you in your field of expertise in breast cancer, and I chose pancreatic cancer, I definitely try to stay aligned with you in the BRCA world. You have been an unbelievable supportive figure for me in my professional trajectory. You've been a world of inspiration as a clinician, as a friend, as a mother, as a role model, as a mother, and as a wife. And ever since I was being a young physician, I've been following you closely and in my way trying to keep close to you. And I'm just very proud of you, and especially just seeing how you've learned to deal with everything, the complexity of your situation, and how you remained and you are still such a pivotal figure in this world, in the oncology world, for all of us. So I love you very much, and just thinking of you all the time, and so proud of you. Thank you.
My name's Andrew Tutz at the Institute of Cancer Research in London. I've known Bella for I think nearly 15 years or so now. Bella, you are one of the most thoughtful oncologists I've ever had the privilege to work with. You are always centered on the patient and their problems. You are always calm, considered, and unfailingly polite, but with real tenacity. And I believe your tenacity and the passion behind it has been most evident to me in the work that you've done for those with BRCA1 and 2 mutations and cancer. I looked back at a letter that Susan Domchek had very kindly kept for us all, that we wrote together and that you're a co-author of back in 2011 when we pushed a fairly big pharma fairly hard to develop PARP inhibitors for that community of patients with BRCA1 and 2 mutations. And Bella, I hope you know how much you have achieved through doing that and through working in that way. It has been a privilege to learn from you along that journey. Your energy in the face of challenges, and I know you have faced many, is truly humbling. Thank you for everything I've learned from you and for what you have done for so many people, so many women with breast cancer. You're a remarkable person.
Bella is also an inspiration to so many people, first and foremost to her colleagues and her younger colleagues, but also to her patients and people in general. And I am just honored to count myself as a colleague and a friend.
Efrat, I completely agree. It's just splendid that we're able to have this Bella Fest. I'm so pleased with it. And it takes me back to a day in your living room now, 25 years ago, when I first met Bella in person. I'd heard her speak before that about translational work in breast cancer. And in your living room, I met her, and I was just about to go to the West Bank for the first time. And at the time, I had no idea of the depth of Bella's experience working in West Bank. And her explanation of her work there was so straightforward, so professional, so warm, so insightful. It made me completely comfortable in that work. And I think for me, it enabled me to have a perspective on what before that had been a culture I knew nothing about, a perspective that was open and accepting, and it just made all the difference. And she said to me, if you want to get a sense of people on the West Bank, get an ice cream cone after services on Friday afternoon. So I asked Maureen's wife if we could do that. So Ola and the girls and I went out after services on Friday afternoon, eating ice cream, surrounded by thousands of people, many of whom were also eating ice cream, and had a fabulous time. Bella just opened that world to me in a way I would not otherwise have known. And for that, Bella, I will always be grateful. You may not even remember those few minutes in Efrat's living room, but for me, they were transformative. Thank you, my dear. I send you a virtual hug.
So I feel really blessed. I was a year after I moved to Israel, I started my work with Bella, and she's definitely been a very pivotal, influential figure for me. And I was lucky to have a mentor very early on. And the matchmaker there was Rafi Katan, who was my other mentor. And he said, I think you should work with Bella. I think this will be a successful endeavor. And I was very fortunate to have a teacher and a mentor. And very early on, I heard stories from Bella about Efrat Lahad and Mary Claire King. And the first time I heard either of your names were from, Bella's stories about BRCA and how important it is and her passion about it. So it's actually really wonderful that we can have this conversation together. And for me, seeing Bella reach this, such well-deserved honors really just really exciting and thrilling. And it's so well-deserved. And I remember also the years where she was so passionately being an activist, trying to make sure that the Olympia that the original studies with the olaparib were going to get off the ground and that it wasn't going to get put on the back shelf. She was so passionate about finding a solution for the women who had the BRCA mutation. So it's really amazing to be able to sit here and have this conversation and to see Bella getting this honor, which she really deserves.
Efrat, tell us more about your work with Bella in the Breast Cancer Consortium.
So I think one of the things about Bella is that she can get people from, I would say, all sides, people who might be rivals in other situations, to really get to work together. And she was instrumental in forming a consortia that includes almost all oncology centers and oncogenetic centers in Israel. And that's really just another testament to her ability to bring people together for the greater good. And to me, that's something that Bella absolutely symbolizes.
Bella, we love you. We send you hugs.
I'll just add that for me, an additional thing that's been amazing with Bella, other than the professional mentorship, is the role model she serves for young female physicians and researchers, and the amazing balance she's always had between being a career woman and having a family, and the atmosphere she created that was so accommodating for female physicians to be able to grow and still manage their family lives in a place that was so accommodating. And I think that's been a real blessing, and I don't think it's something we can ever take for granted. And so that's also been a really important part of the journey, and learning from her, not just professionally, but in terms of a life model, role model as a woman, as a feminist.
So congratulations from all of us, Bella. We can't think of a more deserving awardee. And congratulations again.
Congratulations.
Congratulations.
And it is my pleasure to introduce the keynote by my esteemed colleague and really dear friend, Bella Kaufman. As you will hear from her, Dr. Kaufman has had her own cancer journey and has had metastatic breast cancer for the last 9 years. Her courage and determination are really unparalleled. And this last month has been difficult for her. But in true Bella fashion, she was determined to complete her keynote address. And in the best sense of it takes a village, she was aided by friends and colleagues, specifically Efrat Lahad and Talia Golan. And Dr. Golan has narrated Dr. Kaufman's talk for us today. I want to also specifically say hello and welcome to Dr. Kaufman's family, Yoshi, Noah, Omar, Kim, and Maya, who hopefully are here with us today and have a sense of just how truly valued Dr. Kaufman is to us. And with that, we'll start our keynote address. Thank you.
Shalom to all. My name is Talia Golan, and it is a great privilege that I present this lecture on behalf of Bella Kaufman. Bella is a true friend, a beloved colleague, and one of my mentors. Professor Bella Kaufman is director of the Breast Cancer Institution at the Sheba Medical Center in Israel. The long and winding road to targeted therapy, a story of wine, chutzpah, and the irresistible Susan Domchek. A phase 2 study, olaparib monotherapy in patients with advanced cancer and a germline BRCA1 or 2 mutation. The prevalence of BRCA1 and 2 mutations in Ashkenazi Jewish patients is actually quite high, up to 11% in breast cancer, 40% in ovarian cancer, 8% in pancreatic cancer, 5% in prostate cancer. In cholangiocarcinoma, only 8 patients were screened, so this does not reflect the true number. The prevalence of BRCA1 and 2 mutations in non-Jewish patients is much lower. There are different types of DNA damage, and therefore, different repair pathways are executed in order to repair the different types of damage. Part 1 recruits different repair factors to repair single-stranded breaks. When part 1 is inhibited, there's double-stranded breaks. In a cell that has effective normal BRCA1 and 2 function, homologous recombination-based repair is executed. There's chromosomal stability and there's cell survival. However, where there's PARP inhibition in the setting of BRCA1 or 2 deficient cells, therefore this causes impaired homologous recombination repair, and therefore alternative error-prone repair pathways are executed, thus leading to chromosomal instability and cell death. Originally, olaparib was tested in a phase 1 trial. The maximum tolerated dose was 400 milligrams twice daily, and signs of efficacy were demonstrated in BRCA-mutated ovarian cancer. The background to the study was that oral PARP inhibitor olaparib had shown anti-tumor activity as monotherapy in patients with breast and ovarian cancer in the setting of a BRCA germline mutation. This multi-center, non-comparative study tested the hypothesis that tumors with BRCA1 or 2 mutations are responsive to olaparib treatment, regardless of the tumor type. Originally, Study 42, also coined the Israeli trial, was a phase 2 open-label, non-randomized, non-comparative, multi-center study to assess the efficacy and safety of olaparib given orally twice daily in patients with advanced cancer who had a confirmed genetic BRCA1 or 2 mutation. How did it all begin? At a pharmaceutical reception. In 2007, or perhaps 2008, this one was hosted by AstraZeneca. They had just decided, as you all know, to stop further development of olaparib for a variety of reasons. Having encountered so many BRCA carrier patients in Israel, this felt like to me like the end of the world. You are what you experience. Well, I'm an Israeli non-drinker, and I was definitely drinking more wine than I was used to, holding onto the wine glass like everyone else. Emboldened, with no small measure of chutzpah, I cornered the Deputy Director for Oncology. I think he may have left his position 3 months later. Almost in tears, I begged him, please approve a compassionate use program. How can we desert carriers when there's something that could potentially work? He looked at me and said, it's not going to be a compassionate use program. It will be a phase 2 single-arm study for male and female carriers with any indication, breast, ovarian, pancreatic, or prostate cancer. As it turned out, we also had quite a few cases of cholangiocarcinoma and even some melanoma cases. Initially, his original decision was to perform the study only in Israel, limited to 150 patients. I created an ad hoc steering committee of Israeli opinion leaders in order to formulate study criteria, and AstraZeneca allocated a helpful Czech representative who assisted with the finalizing the protocol. And yes, the study took off in an unprecedented fashion for Israel. Even European patients came to us in order to participate in the study. Well, the so-called Israeli study was to include 150 patients, but word got around. And then Susan Domchek heard about the study. As the title of my talk indicates, Susan is irresistible, and wonderfully so. And soon the study became an important and global study. So the study design was approximately 300 patients. All tumor types were expected, but not limited to ovarian, breast, prostate, and GI tumors. It was expected that a minimum of 20 patients in the pancreatic and prostate cohort would be recruited. BRCA status was determined prior to entry into the study according to local practice. Recruitment period was 12 months. United States, Australia, Germany, Spain, Sweden, and Israel participated. Our primary objective was to assess the efficacy of oral olaparib in patients with advanced cancer who have confirmed germline BRCA1 or 2 mutation. The primary objective was response rate by RECIST 1.1. Secondary objectives included progression-free survival, overall survival, duration of response, disease control rate, and safety. The target study population included patients who were refractory to standard therapy and for which no suitable effective curative therapy exists. Patients were given olaparib twice daily at 400 milligrams and treated until disease progression. The breast cancer cohort included patients who must have failed at least 3 previous lines of chemotherapy in the metastatic or advanced setting, not including hormonal therapy. In ovarian cancer, the cohort included at least 2 prior chemotherapy regimens in the advanced metastatic setting, including 1 platinum-based regimen and liposomal doxorubicin. Pancreatic cancer patients must have either failed or been unsuitable for gemcitabine treatment in the advanced setting. Prostate cancer included hormone refractory disease defined as testosterone value in the castration range and at least 2 consecutive rising PSA values. And these are the results. Israel was the main recruiter, followed by the United States, Australia, Germany, Spain, and Sweden. The toxicity profile was very similar to previous studies, in all grades, fatigue being the most common, and for grade 3 and 4, anemia being the most common toxicity profile. These are the efficacy results. One can see that in ovarian cancer, 3.4% of patients had a complete response, 28% had a partial response, and stable disease was 41%, with overall response rate 30%. PFS median was 7 months, and median OS was 16.8 months. The CT scan shows a peritoneal implant in a patient with ovarian cancer that progressively got smaller over the course of time when being treated with olaparib monotherapy. In the breast cancer cohort, no patients had a complete response. Partial response was 13%, stable disease 47%, overall response rate 13%, and median PFS was 3.7 months, with median overall survival being 11 months. In this slide, we can see a patient with BRCA1 mutation in a triple negative breast cancer after previous treatment with chemotherapy. Her lung lesions disappeared on treatment, and her duration of treatment was approximately 2 years. In the pancreatic cancer cohort, we had 1 patient with a complete response. Actually, this was my patient. And partial response was seen in 17% of the patients, stable disease 35%, overall response rate was 22%, median PFS was 4.5 months, and median OS was 9.9 months. This is a patient with pancreatic cancer and liver metastases. When he went on to the clinical trial, and on olaparib monotherapy, the liver metastases disappeared. In the prostate cancer cohort, partial response was seen in 50% of the patients, stable disease 25%, overall response rate was 50%, and median overall survival was 18.4 months. And this is the accumulation of all the other tumors. These are the participating centers. And our scientific conclusion was that the observed complete response and partial response rate indicate responsiveness to olaparib monotherapy, even in patients with advanced cancer refractory to standard therapies and a germline BRCA1 and 2 mutation. Specifically, interesting clinical benefit was seen in prostate cancer and in pancreatic cancer. Prolonged responses to olaparib were observed across all tumor types. Olaparib was generally well tolerated, and toxicity profile was consistent with previous monotherapy studies. Tamir Gilat, the last man standing. Well, every good story needs a love story, and a miracle, or maybe half a miracle. Karen and Tamir met slightly after she was diagnosed. After they had met, she was diagnosed with local breast cancer. She received neoadjuvant chemotherapy and had a pathological complete response. During her follow-up, she was tested positive for BRCA2 mutation. The beautiful couple then went on to have 2 beautiful daughters, as you can see here in the picture. However, in 2011, Tamir was diagnosed with simultaneous pancreatic cancer and renal cell carcinoma. He had a Whipple operation and a nephrectomy, and on adjuvant chemotherapy, had a recurrence in his liver metastases from his pancreatic cancer. He had also been tested positive for BRCA2 mutation, and he was offered to enter study 42. During this time, Karen's disease recurred. She received multiple lines of endocrine therapy and a CDK1 and multiple lines of chemotherapy. She also received niraparib in a clinical trial, and a large supraclavicular lymph node disappeared within weeks and never grew back. However, she only responded to niraparib for a short period of time, and under treatment, she developed ITP. Tamir was in study 42 from 2011 till 2015. He had a complete response to his liver metastases. However, in 2015, he had a recurrence from his metastatic renal cell carcinoma. He underwent major set therapy and went on to receive Ipi/Nivo. His disease has almost disappeared, and he's still receiving this treatment. Unfortunately, while Tamir in 2015 was in ICU recovering for removal of his new metastases, Karen was hospitalized in a rapidly evolving liver failure. She unbelievably responded to gemcitabine in combination with cisplatin within a week, and her bilirubin normalized from 13. However, 2 years later, in 2017, Karen passed away. Tamir now looks after his 2 kids with the help of Karen's mom and is a major recruiter to cancer treatment, to cancer research in Israel. So what's next? Well, I think we need to really think about targeted therapy for ATM and perhaps CHEK2 carriers. And my story. In 2005, I was diagnosed with bilateral breast cancer, both T1, N1, hormone receptor positive, one lobular invasive, and one ductal invasive. Things were quiet till 2012. And then I had a recurrence with liver metastases, and I have been on treatment since. In September 2013, I was found to be a carrier of the CHEK2 S428F. Yes, I am too an Ashkenazi Jewish woman. This particular road has not been easy. And if you want to hear more about being a breast oncologist with metastatic breast cancer, the whole story is on YouTube in Bella Kaufman's keynote lecture, Living Two Roles, Oncologist and Patient. So what are my real world conclusions? Well, maybe try being more mellow than you used to. And if you need, use a bit of wine. And there's nothing wrong with chutzpah, and a little bit more chutzpah. And nothing happens without Susan Domchek. And where did we get on this winding road? Well, there's FDA approval for the indications in the phase 2 trial in ovarian cancer, breast cancer, recently in pancreatic cancer. And this even spurred international studies like the POLAR study just mentioned. And PARP inhibition is now a mainstream part of clinical care in many tumor types with BRCA mutations. Thank you all for listening, and let's raise our glasses to you, Bella. We love you very much.